Kidney health and nutrition. A diagnosis of kidney disease means more doctor visits, various lab tests, changes in diet, and the likelihood of dialysis or even a kidney transplant in the future, should the disease progress far enough. Diet and medications can hold this off, perhaps even indefinitely, which shows how very important diet is in maintaining health. Listening to the advice of a nutritionist is supremely important for a kidney patient in any stage of the disease. Sometimes this can slow or even stop the disease from advancing, but in some people, nothing they can do will stop the disease from becoming more serious. Lab tests will become a constant need. Frequent blood and urine samples are just the beginning. Kidney disease that is serious may even require a port placed into the body so samples can be drawn without the use of needles each time. The port can also be used to introduce medications into the body, but this measure also requires extra patient care or assistance from family members or even a nurse. Here are a few of the lab tests involved in kidney disease treatment. Serum creatinine measures creatinine, a waste product created by muscle activity. Normally, the kidneys remove this from the body, but it may start to back up in the blood vessels in the case of kidney disease patients. This is often one of the first signs of kidney problems. GFR or glomerular filtration rate is a general determination of how well your kidneys are functioning. A GFR of less than 30 is a problem that will need the attention of a nephrologist or kidney specialist. A GFR that is under 15 is a serious problem, indicating dialysis or a kidney transplant will be necessary. BUN or blood urea nitrogen is formed when the body breaks down protein either from food or from regular metabolic processes. The kidneys would normally filter this waste from the body, but when the kidneys start to fail, urea nitrogen levels rise. This can also happen when a patient simply eats too much protein. Too little protein can cause the BUN level to decrease. Urine protein is the accumulation of protein in the patient's urine. Some protein is necessary for your body to function. It is a major macronutrient. The body uses protein for a vast number of functions, and kidneys do the work of filtering it and its byproducts from the bloodstream. When the kidneys are not working properly, protein starts to collect in the patient's urine. High, consistent and persistent levels of protein in the urine are often another sign of kidney damage or disease. Microalbuminuria is a test used on patients who have a high risk of contracting kidney disease, such as those who have high blood pressure or a family history of kidney troubles. This can detect tiny amounts of urine in the bloodstream that most tests will miss. Ratio of protein to creatinine is something of a shortcut. Often, a doctor will require a sample of urine, of 24 hours, which can give an accurate measure of how much protein is in the patient's bloodstream during the course of a given day. This test requires a great deal of patient participation because it requires collecting and refrigerating urine to bring to the lab for testing. The doctor can simply measure the protein to creatinine ratio instead, making it easier for patient and doctor. Serum albumin is a protein measurement test based on albumin, a vital body protein. The body uses protein from food to create the hormones, amino acids and enzymes that regulate all sorts of body functions. If the blood albumin content is low, it generally means the patient is either receiving too little protein through the diet or too few calories. The human body is not able to store protein from day to day and needs new sources regularly. Lack of blood albumin can cause a number of health problems, including a reduced immune system. Normalized protein nitrogen appearance, NPNA, is a test used to determine if the patient has enough dietary protein or has too much protein. This test requires blood and urine samples, and sometimes a food log. SGA or subjective global assessment may be a request from the nutritionist rather than the nephrologist. This is used to find signs of nutritional irregularities. First, questions are asked about the patient's daily diet, and then a weight check is performed, as well as a check of fat and muscles in the face, arms, hands, shoulders, and legs. Hemoglobin is one of the components of blood. It is the part of the red blood cells that carry oxygen throughout the body from the lungs. Low hemoglobin is a condition known as anemia. Increasing iron intake and a certain hormone will treat anemia. Hematocrit measures how many blood cells the body is currently making. TSAT and serum ferritin measure the amount of iron in the body. Parathyroid hormone, PTH, is caused by an imbalance of phosphorus and calcium. PTH levels that are really high can result in bone disease. Calcium is a main component of healthy bones. Several types of kidney disease will leach calcium from the blood, so the levels need to be monitored. Phosphorus can be dangerous and weaken bones if the levels are too high. The doctor and nutritionist may have to reduce the patient's amount of this mineral. Potassium is another mineral that can cause problems when there is too much consumed. While it is necessary to maintain the muscles, including the heart, an excess will deteriorate the muscles and cause heart irregularities. Kidney disease patients often need a good source of protein that is low in fat and easily digestible. ProfectR, a liquid protein supplement from Protica, fits the bill. It is small enough, less than 3 fluid ounces, to carry easily anywhere, and has only 100 calories. 2 servings a day should be plenty for most when supplemented with plant protein sources.